Welcome back. I'm Kirsten Holmes.
And I'm Steve Price. Black women are nearly 3 times more likely to die in childbirth than white women. This comes from several reports from the CDC.
Yeah, those reports also find that the maternal death rate for black women increases with age, meaning it only gets worse. And it's not just black women. The maternal mortality rate has increased for white and Hispanic women too. I talked to local doctors who say they are doing everything they can to stop this trend. Others I spoke with say black families have been suffering with this issue for far too long.
She's like the coolest baby and so smart and yeah, chill.
She's already like, she's crawling, she's lifting her head, like, and those eyes.
Yeah.
Oh my God.
Whitney and Amari Anderson are brand new parents. Whitney says she always knew she wanted to go a different route on her journey to becoming a mom.
I never felt advocated for in medical spaces. I lost a friend a few years ago. She was birthing her 3rd child in a hospital and had complained about some pain she was having afterwards and was overlooked and passed away from hemorrhaging.
And when she and Amari found out they were expecting,
And I was like, I want to be in a birthing tub. And at first he was like, wait, what?
You want to be in the tub?
And I was like, I want you to be in the tub with me.
Whitney and Amari are like a lot of young black couples who choose places like the San Diego Community Birthing Center for their growing family.
No matter what, we're going to feel supported. No matter what, my partner's going to feel supported. And you don't get that at a hospital.
The CDC says maternal mortality is actually on the rise across all racial demographics. This as more families, no matter their race, look for alternatives like midwives, doulas, and birthing centers. Nikki Helms, a local midwife with the San Diego Community Birthing Center and Whitney and Amari's midwife, says more families started choosing birthing centers during the pandemic.
A lot of people were very put off by the idea of having to be in a hospital where people were sick and people were dying and to have a baby. The 1-to-1 patient to clinician ratio gives me more opportunity to pay closer attention to what is happening.
According to the U.S. Government Accountability Office for Black families, the maternal death rate was about 44 per 100,000 live births in 2019. It was 55.3 in 2020, and it rose to 68.9 in 2021. White families had death rates of 17.9, 19.1, and 26.1 respectively.
This is actually a public health crisis, and it represents a failure of our American healthcare system. Even when you correct for adequate healthcare insurance and you correct for socioeconomic status, you still see this disparity. That points to a bias, and we know that there is bias. Sometimes it's conscious and sometimes it's unconscious.
Dr. Olulade says as doctors and hospitals shift from awareness to acceptance of the deadly situation for families, particularly families of color, Sharp and other hospitals are doing what they can to bring those numbers down.
We want to make sure that you can track those standards so that it can be easily seen that everyone is getting the same care. What the research shows is that Black women in many cases receive a lower quality of care and also delayed care.
As Whitney's delivery progressed, she had to be transferred to a hospital setting. 3 weeks after welcoming their beautiful bundle of joy, for Whitney and Amari, the best way to protect their growing family started with thinking outside the box.
They don't really listen to Black voices, particularly Black women, just to make sure we were both safe and everybody was safe. I think birthing center was the best option.
You know, a lot of people have heard about Serena Williams. If you haven't heard about Serena Williams' story, there are so many Black women across all socioeconomic points and factors that have this situation. It's like we go into the hospital and we all have similar situations. And then I've talked to a lot of moms because I've been working on this story for a while. A lot of moms are saying, yeah, no, we're choosing birthing centers. Shout out to the San Diego Community Birthing Center for letting me in. They're choosing birthing centers because it feels like home. This was my first time in a birthing center, and oh my gosh, I was surrounded by babies. I was just telling Steve, I'm very much a career woman, but I am looking at life completely differently. There was something divine about the experience.
The thing is, no matter where you're giving birth, it's a stressful situation.
Yeah.
And so if you can be in a situation, anyone, where you're more calm and you feel better about it,
Yeah.
that's a win for everyone.
Absolutely, and it's so much easier. Such a vulnerable time. Thank you so much to Amari and Whitney for sharing a piece of your
Yes.
heart with us. Thank you, guys.